Hello, my name is Dr. Koheli and today we will be talking about vitamin D. A lot of times whenever I upload on Instagram that I'm taking vitamin D supplements, a lot of questions come up like why am I taking it, who should take it, is it safe for children to take, is there a chance of overdosing, and what are the sources of vitamin D. And so we are today going to tackle about all the questions related to vitamin D, especially starting with what are the uses of vitamin D. Now, a lot of us have studied back in school that vitamin D is required for bone density as well as calcium absorption. Now, this is well known. But did you also know that it is important for immunity? It is important in autoimmune diseases. It's important in infertility. It is important as an anti-cancer. It has uses in controlling diabetes, in controlling depression, in controlling, weight loss and appetite suppression. It helps in controlling of myopia or the growth of eyes. It is useful in muscles as well as improving muscle size and strength. So, how does it help in immunity? Why am I talking about immunity first? Is because there's a lot of importance of vitamin D during COVID times as well. So vitamin D is useful in the action of natural killer cells. Now these cells get activated whenever there's an antigen which enters, especially viruses, and it gets activated, and also it has a role in getting deactivated once the antigen or the virus or the problem has been solved. Now, many a time the body continues to overreact to any kind of antigen, and the body is creating more immune response than what is required, and this suppression of this overaction of these cells is also controlled by vitamin D. So vitamin D is important for immune response as well as helpful in autoimmune diseases, and both of these are required in especially a complex condition like COVID-19. Then comes in infertility. So vitamin D helps in controlling the amount of estrogen in our body, and therefore if you are trying to naturally get pregnant or are taking some kind of pregnancy, artificial pregnancy, in vitro fertilization, in both the conditions having a good amount of vitamin D levels is important. So much so that it also has anti-cancer properties of many cancers, and yet breast cancer, it has been seen that it can help prevent breast cancer as well as vitamin D. If your levels are good, then it has shown that even survival rate once you have had breast cancer is much better if your vitamin D levels are better. And it also, the same thing applies to diabetes or weight loss or immune appetite suppression. If your vitamin D levels are low, then these are the conditions where it's been seen that there is a higher correlation between diabetes, higher correlation in myopia progression, that is increasing in your number, higher incidence of depression, and therefore it is important to have good levels of vitamin D. So how do you know if you have good levels of vitamin D? You are not looking for vitamin D deficiency symptoms. The symptoms of vitamin D deficiency come in very much later. We are looking at optimal amount of vitamin D, and that can only be found by doing blood tests for vitamin D. Now, doing these blood tests, we'll be talking about blood tests a little bit later. Now, let's talk about sources of vitamin D. The most important source of vitamin D is your own skin, because the body produces vitamin D3, the form of vitamin D which is usable, which is D3. Now, how does it convert? So, it converts sunlight, and how much of sunlight is required? Mostly we said 20 minutes of sunlight every day, but that depends, will it give you enough vitamin D? It also depends on the race. If you're an Indian, or if you live in colder climates like Norwegia or Norway, or colder climates, they are better able to form vitamin D. But Indian skins or darker skins produce lesser amount of vitamin D3 on the same sunlight because of our melanin. So the melanin prevents ultraviolet rays, and these UV light is very important for the conversion of vitamin D3. The same thing with sunscreen. We lather ourselves with sunscreen, or we wear very full clothes, and therefore the skin is not exposed to direct sunlight, and these are again reasons for not being able to absorb enough vitamin D3. So are there any vitamin D3 sources of food? No, there are no vitamin D3 sources of food. There are vitamin D2 sources of food. So D2 sources of food can be plant-based. They can be fatty fishes like salmon or mackerel. They can be in liver, especially cod liver oil, or they can be fortified foods like your wheat, grain and dairy and milk and cheese, which can be fortified with vitamin D. But the best source still remains sunlight and supplementation. Now let's talk about supplementation a little. So how much of vitamin D supplementation you need totally depends on your vitamin blood levels of vitamin D3. And now let's talk about the tests that you will get done for vitamin D3. So vitamin D3 is tested as a blood test. You do not need to be fasting for this blood test. This blood test can be done for very young children as well as very old. So even very young children who are just born can also get this test done. Now the test which we want to do is 25 hydroxy cholecalciferol. So that is your vitamin D3 free levels. Now vitamin D is stored in our body also. It is stored in the fat, it is stored in our liver. But that is not the form which we are going to be testing. We are going to be testing the free form of vitamin D3. So the next point comes that what are the levels which are normal. So the level of vitamin D3 in our body should be somewhere between 30 to 100. Now 30 to 100 nanograms per ml is the range which is given. So what is better? Is 30 better or is 100 better? So you want to be somewhere in the middle between 40 to 80 nanograms per ml. If it is less than 40, consider yourself insufficient and you may take about 60,000 units of vitamin D per month. If it is lower than 30, you want to take 60,000 units per international units of vitamin D per week. But again, amount of vitamin D supplementation which you will be taking depends on your treating doctor. So the first step is getting a blood test, which I already told you. You don't need any kind of fasting. You can get it done and you can repeat this blood test every 3 to 4 months. Why 3 to 4 months? Because the body stores the vitamin D. So as and when it requires vitamin D, it comes into the blood circulation. So the stored amount, so you can supplement your vitamin D not every day. You don't need to take a supplement every single day of vitamin D, unlike vitamin B and vitamin C. Now there are two types of vitamins. There are water soluble vitamins and fat soluble vitamins. Water soluble vitamins like vitamin B and vitamin C have to be taken daily because they get removed by the body in the form of water, in the form of urine and sweat. But fat soluble vitamins, which is vitamin A, D, K, E and K, these get stored in the body. So the advantage is you can take a good amount of vitamin D and it can be stored in the body and it can be utilized as and when the body needs. Now about a little bit about the supplementations. The supplements of vitamin D for children, it is available as drops, vitamin D3 drops. You also have capsules of vitamin D3. You also have powder form of vitamin D3. Now, whenever you're taking vitamin D3, remember that it is fat soluble. So it will be better absorbed in your body if you have a fatty meal. So have it after your meal. Have a good food with a lot of ghee or butter. That will help in the absorption of the vitamin D3. After you've taken vitamin D3, so we take it monthly, but if you are low in vitamin D3, you want to take it weekly. What is the level that you want to maintain it between? You want to maintain a good blood level of between 40 nanograms per ml and 80 nanograms per ml. Almost 60% of India is insufficient, has insufficiency of vitamin D3, and therefore it is very important to get your blood levels checked. We are not looking at extreme deficiencies where a lot of deficiency symptoms come up. We are looking at optimal amount of vitamin D3 in our body, which can then have all these anti-cancer and autoimmune benefits for the body. And now let us talk about overdosing. Is it possible to overdose yourself on vitamin D? Yes, it is. Why is that possible? Because the body stores the vitamin D in our body, in our fat cells, in our liver. Of course, the body is able to titrate it. It's not going to be like if you take 60,000 units a month. So the first day your vitamin D3 is going to shoot up and then slowly it's going to come down. No, the body is going to just store it and slowly it's going to release it as and when the body needs the vitamin D3. But who is going to get this huge amount of overdosing? So it's not very easy to overdose also. When would you overdose? You are supposed to take 60,000 units, say once a week, because your vitamin D3 is low. But instead of once a week, you misunderstand the doctor and start to take it daily. So you've taken 60,000 units every single day for a month, and that is when your levels are so high that the fat does not just store the vitamin D3 and it starts to, even the free amount of vitamin D3 in your blood is high. So how will you know if you have an overdose of vitamin D3? You will again do a blood test, and as I said, the normal levels are 30 and 100. Anything above 100, especially anything above 130 nanograms per ml of vitamin D3 is when you have an overdose. Now, all the symptoms that happen because of overdosing of vitamin D3 is because of the increased amount of calcium in our blood. So as we said that vitamin D helps in the absorption of calcium. So hypercalcemia will lead to fatigue, confusion, increased thirst, nausea and vomiting. And also vitamin D can remove the calcium from the bones, excess vitamin D. So that is again something that can happen. So the best way, of course, is to take vitamin K. So taking vitamin K along with the vitamin D helps to maintain, absorb calcium of course, but vitamin K helps to keep the calcium within the bones. So I hope this video helped you understand what are the uses of vitamin D3, what are the sources of vitamin D3, how to get the blood test for vitamin D3, and what are the levels for low vitamin D3, optimal vitamin D3 and overdosed vitamin D3. How to take these supplements and how to take a fatty meal along with the vitamin D3, and what are the symptoms that you would have after if you have an overdose of vitamin D3. Again, you would want to test it. You would not want to just guess that, oh, I might have overdose. You want to do a blood test and find out. And if you have any other questions related to vitamin D3, how to take it, especially in children or in adults or in pregnancy or in lactating, yes, it is safe in pretty much any kind of, from newborn to even pregnant and lactating women can take vitamin D3 and is recommended to take. And if you have any other questions, do leave a comment below and do share this video if you found it valuable, if you found the information worthy of sharing with your friends and family. Thank you.